So in this video we'll discuss about knee joint in a rough way. Okay. So let us see about what is the knee joint means, what are the articular surface of knee joint, what are the ligaments present in them. Just an introduction way, not a total summary. What are the bursae there? Okay. What is the relations present there? What are the blood supply? What is the nerve supply? What is the movements? What are the muscles producing those? What are the stability contributors? What are the clinical anatomy? You have to know. Just an overview, not a deeper view. Okay. So let us see. This is a knee joint. I have given the image of a knee joint. You can see them. Okay. This is a medial condyle. This is a lateral condyle. You have anterior cruciate, posterior cruciate. Okay. Fibular collateral, tibial collateral, medial meniscus, lateral meniscus, biceps femoris tendon, fibula, patellar ligament, tibia is there, and transverse ligament is present. So knee joint is the largest and most complex joint with a fusion of lateral femoral tibial, medial femorotibial, and femoropatellar joint. So femorotibial, this is a femur, this is a tibia, femorotibial, lateral, medial femorotibial, and the patellofemoral joints. It's a combination. The condylar synovial joint between the condyles of femur and tibia. So femur condyle is this. This is the tibia condyle. So between those, the condylar synovial joint, and between the femur and patella, it's a saddle joint. This is the femur. This is the patella. This is a saddle joint between them, and condylar joint between the femur and tibia. So you have to know the articular surfaces. There is a condyles of femur, there are condyles of tibia, there is a patella. These are the articular surface. Next, you need to know about the ligaments present in them. So there is a fibrous capsule. There is a ligamentum patellum, or you can call it as patellar ligament. You have a tibial collateral ligament. This is a tibial collateral ligament. This is a fibular collateral ligament. Okay, and if oblique popliteal ligament, arcuate popliteal ligament, anterior cruciate ligament, posterior cruciate ligament, medial menisci, this is a medial menisci, this is lateral menisci. Okay, so transverse ligament and coronary ligament, 12 ligaments present there. So the main here are fibrous capsule, ligamentum patellum, tibial collateral, fibular collateral, then anterior cruciate, posterior cruciate, medial meniscus and lateral meniscus. These are the main ones. The supplementary ones are oblique popliteal ligament, arcuate popliteal ligament, transverse ligament, coronary ligament. Okay, these are the secondary ones. Bursae around the knee. There are anteriorly, there are subcutaneous prepatellar, subcutaneous infrapatellar, deep infrapatellar, and suprapatellar bursa, and anterior view. Laterally, you have bursae deep to the lateral of gastrocnemius, bursae between the fibular collateral ligament. This is a lateral ligament. You can see it right here, lateral part. Fibular collateral ligament under the biceps femoris. There you have biceps femoris. Lateral between the fibular collateral ligament and biceps femoris, you have a bursae. And there's a bursae between the fibular collateral ligament and popliteus tendon, and there's a bursae between the popliteus tendon and the lateral condyle of the tibia. Medially, deep to the middle head of gastrocnemius, the anserine bursae, okay, which is just a communication, complicated bursal separates tendons, sartorius, gracilis, and semitendinosus from the tibia and from tibia collateral ligament. Deep to the tibia collateral ligament, you have a bursa, and deep to semimembranosus, there is a bursa. This is the bursae. There are about 12 bursae, 4 on the anterior, 4 on the lateral, 4 on the medial side. Relations of the knee joint. It's a very important question to be asked. So relations of the knee joint. Anteriorly, there is an anterior bursae, ligamentum patella, and patellar plexus of nerves. So this is an anterior view. You can see ligamentum patella. Okay, patellar bursa you have, and the patellar plexus of nerves is present there anteriorly. Anterior bursa. Okay, posteriorly you have at middle popliteal vessel, tibial nerve. Posterior laterally, there is a lateral head of gastrocnemius, plantaris and common peroneal nerve. Posterior medially, medial head of gastrocnemius, semitendinosus, semimembranosus, gracilis and popliteus insertion. So you should know what is posterior lateral, what is posterior medial, what is at middle. At middle, you have popliteal vessels at tibial nerve. At laterally, lateral of gastrocnemius and common peroneal nerve. Whereas at medially, middle of gastrocnemius, semitendinosus, semimembranosus, gracilis and popliteus. Medially, if you go, you have the sartorius, same these things will repeat. Okay, gracilis, semitendinosus, you have great saphenous vein is its nerve, and semimembranosus, gracilis, semitendinosus, sartorius and all you have. Laterally there is a biceps femoris and origin of popliteus tendon. Blood supply are 5 genicular branches, a descending genicular branch of femoral artery, descending branch of lateral circumflex femoral. Okay, the two recurrent branches from anterior tibial artery and posterior tibial artery. So you have genicular branches, you have lateral circumflex descending branch, you have the descending branch of femoral artery, and there will be a circumflex fibular branch of posterior tibial artery. Anterior tibial artery recurrent branches posterior tibial artery. So anterior tibial artery, posterior tibial artery, genicular branches, descending genicular branch of femoral artery, descending branch of the lateral circumflex femoral artery. This will take place in the anastomosis of the knee joint, these arteries. Nerve supply, you have femoral nerve, sciatic nerve, obturator nerve, okay, will be present. Then movements you can see the extension. So femoral, sciatic and the obturator nerves. Okay. This is the adductor compartment, this is medial compartment, the posterior compartment, all the three nerves. So movements if you see extension is caused by, flexion is caused by biceps femoris, semitendinosus, semimembranosus. Whereas extension is caused by quadriceps femoris. Okay, whereas the locking is caused by vastus medialis, unlocking is popliteus, medial rotation is semitendinosus, semimembranosus and popliteus, lateral rotation is the biceps femoris. Next, you have the stability of the joint is maintained by cruciate ligaments in anterior posterior stability, collateral ligaments by side to side stability. Okay, what are the cruciate ligaments? Anterior and posterior. So anterior, posterior. Collateral ligaments are medial and lateral collateral ligaments. So side to side stability, and various ligaments and muscles and all strengthening the capsule. Clinical anatomy, there is an osteoarthritis, is a age-related disorder where there is a degeneration of the articular surfaces and there is a growth of osteophytes. Deformities are genuvarum, genuvalgum and genuregavatum. Genuvarum is abdominal adductor, valgum is the abducted, bony and knock knee. Genuregavatum is an extension abnormality. Disease of the knees, there will be collection of fluid in joint cavity, so swelling will occur at the side of patella. Aspiration has to be done on the side of patella. The bursa will get filled with fluid. Menisci, the medial menisci is more vulnerable to injury than the lateral menisci, and this will happen due to the rotatory movements. Cruciate ligaments, anterior cruciate ligaments most dangerous, most damage actually due to the hyperextension of the knee. Okay, so injuries to collateral ligament are less common and produced by abduction adduction. So collateral ligaments are abduction adduction, cruciate ligaments are hyperextension, whereas the menisci is due to the rotatory movements. So semimembranous bursitis is quite common and causes a swelling in the popliteal fossa region. So we have seen in knee joint about what, like diagrammatic view you have seen. You have seen the articular surfaces, general introduction, type you can see, articular surfaces, what are the ligaments in them, what are the bursae, and what are the relations we have seen, the blood supply, the nerve supply, movements and the muscles producing those movements, stability, and the clinical anatomy of the knee joint.